Hi, I'm Angela Bosson. I work in the patient care team at Core Clinics, and I also am the coach at Help the Healer. I wanted to do a little post on Mental Health Awareness Week. You might be aware that this year's theme is around body positivity and body image. I've been talking to colleagues and reflecting on this a little bit, and just had some thoughts about what role we potentially have to play as health and wellness professionals. We had a discussion in the clinic about how media, Instagram, and the kind of posts that you get increasingly from aspirational people in health and wellness can be positive and negative in terms of people's body image and health behaviours. So I guess you have, on the one hand, the very aspirational fitness professionals, nutrition professionals who very much embody, I guess, an idealised version both of physical appearance and of and dietary and fitness habits. And they often have, very high number of followers, and they post and show what looks like a very disciplined, very effective fitness, dietary and health regime, which can be very aspirational, and which many young people, particularly perhaps more younger, impressionable people, very much aspire to. And obviously, for some people, those health and fitness professionals can be very motivating, can give them ideas and inspiration which can be helpful in their own health seeking behaviours, or give them goals to aim for. And I think if you're already someone who is fairly disciplined, fairly knowledgeable, you perhaps have a fitness regime, you know a lot about healthy eating, but you're looking to improve it, then those people can certainly be good resources for you. There's obviously the caveat that just because somebody has a big following and proclaims expertise about health, fitness, well-being, it doesn't necessarily mean that they actually are evidence-based in what they're talking about. I've seen articles recently, research done on the advice given by nutrition professionals, some of the biggest kind of bloggers and Instagram people online, and a significant proportion of it is actually not in line with current evidence about diet and nutrition. So first of all, there's the fact that the advice and what they're demonstrating to you might actually not be completely correct, or in some cases at all correct. But secondly, there's the aspect of, for some people, the kind of almost unrealistically perfect image of health, fitness, body, nutrition, whatever it might be, it is actually demotivating and potentially harmful to people who, in the real world, feel they could never achieve those standards, and possibly they can't. If your life and your career and your kind of personal motivation is around having a very healthy lifestyle, or very much focused on creating a certain appearance, you probably are going to be more motivated and have more resources than the average person to do that. So I think a lot of people would be able to achieve a kind of idealised body shape, level of fitness and level of health if we had the knowledge, the time, the financial incentive, the support team around us, a chef, a nutritionist and all those things. But people can often feel that they should be able to emulate the social media experts in these fields, but without all of the resources and their knowledge and so on that they have. However, on the other end of the scale, there is a huge challenge for people working in health and wellness at an everyday level, where they are trying to motivate and encourage and inspire their patients or their clients to make positive changes for their health and well-being, but it's apparent that the professional themselves doesn't necessarily follow their own advice. It's a huge problem in the NHS, where the people that work in the NHS are being asked to support, encourage and inform patients to make positive changes to lifestyle, to eat a more healthy, balanced diet, to reduce alcohol consumption, to cut down on perhaps stress in their lives or get better at managing it, stop smoking. And yet across the population, NHS employees are some of the people that struggle most with those things. 40% of nurses are obese. There's growing numbers of GPs who are seeking help for alcohol and drug problems. And actually mental health of people and workplace stress in the NHS is amongst the worst. And so if you are trying to be credible in your advice or understand the steps that someone needs to take to change their lifestyle, but yet you clearly look or you are internally struggling with those things yourself, I think it makes it a lot more difficult for you to encourage your patients. So it's interesting, I think we've got this dichotomy really, where on the one hand, some people are, walking the walk, talking the talk, looking very aspirational, but potentially make themselves inaccessible, unrealistic, and even negative role models to some people who are kind of beating themselves up because they can't achieve that or they don't believe they can. On the other hand, you have people who are not credible role models because they apparently don't follow any of their own advice. As an example, we've had nutrition professionals in our team, and I've consulted nutrition professionals myself in the past, particularly when I was expecting my third child and I had gestational diabetes. And on the one hand, if you go to see a dietitian or a fitness expert and they either appear to be overweight or have unhealthy eating patterns, there's a credibility problem there, and you kind of find it difficult to take their advice. However, we've also worked with some, very lean, trim nutrition professionals who are clearly very disciplined and haven't really ever struggled with some of the food-related issues that a lot of people do have. And our patients often struggle to work with those people as well because they felt, rightly or wrongly, that there was a lack of empathy there, and that how could this person possibly understand the physical or emotional aspects of having overeating or having disordered eating when apparently they themselves never looked like they'd struggled with that. So it's a real challenge, I think, if you are a doctor, a fitness professional, or just anyone involved in trying to encourage other people to be healthier, to look after their body, and sit in that area between being health aware but not being obsessive or beating yourself up because you can't obtain some apparently impossible standard. So the kind of place I've come to so far on this is that in an ideal world, we should be aiming to be accessible but aspirational. So yes, you want to look like you follow some of your own good advice and that you are credible on the topic, so that your patients kind of buy into you and have belief in your advice. But if you are so inaccessible that people feel they could never emulate that, I think people will kind of switch off potentially. So the kind of term I've coined is accessibly aspirational. So, think about how you are a role model for people and how you want to, practice what you preach to an extent, but also be real with people about, none of us is perfect. The Instagram world is the highlights reel, but there's certainly things behind that which you need to strike a balance with. That people want to see you demonstrating how to do the exercise or the healthy meal that you've planned for yourself, but they also want your help to understand about other struggles you might have had, or that you do understand and empathise with other people who haven't found that so easy. So thinking of some people that I follow on social media, there's some personal trainers who are certainly physically very fit, very muscled, and clearly work out quite a lot. But they share also quite openly about some of the challenges they've had perhaps with their mental health, or that for them sometimes exercise is not always something they enjoy and love, but is the kind of flip side for them of sometimes having a bit of a blowout with their diet. Or on the other hand, you might have people who work in the area who perhaps don't look like the stereotypical Instagram celebrity. People who are slightly larger perhaps, but actually, are fit and active, and have a healthy, balanced, nutritious diet. And I think overall to focus on the body, not just as an external representation, about, training in order to just look a certain way, or restricting your eating to achieve a certain weight, but actually thinking about what being fit, being more active, having a healthier diet does to you as a whole person, and in terms of your internal health, the strength of your body, the flexibility, and again, to bring it back to the kind of mental health aspect, all of these things have a huge effect on your mental health and well-being. A diet which is got lots of processed food, too much alcohol, insufficient hydration, is lacking in certain vitamins and minerals, is going to produce negative mental health outcomes just as much as physical health outcomes. And similarly for exercise, particularly if you're kind of getting out in open spaces, not only are you helping your heart health and reducing your risk of chronic diseases like cancer, but in the short term you're helping your mood. It's kind of protective against anxiety and depression, and in the longer term, it's protective against things like dementia as well. So I think obviously we're visual creatures. Obviously we all notice appearances, and social media, particularly with video, is increasingly about that. But I think we have a real duty and responsibility to not just show that show reel and talk about what happens behind it. That's my thoughts on the topic for today, and I hope you find it interesting. I'd be interested in your thoughts. Thank you.